as you can see, in Baringo, as far as health is concerned, we still have a lot of challenges, especially in our health institutions and health facilities. Yes, we thank God that the county government are doing the level best, and even national government are also doing the level best to ensure that those hospitals are equipped and there is funds for renovations, there is funds for development. But the greatest challenge that we have today in Baringo is about many dispensaries and health facilities which has been constructed and they are not complete. You can go around and see. And for the few that are fully complete, there are some areas which need to be checked. Staff, in as far as even training is concerned.
And even posting of staff. There are some facilities that have been completed, but they are not operational.
Yeah, there are so many. And you'll find a hospital, there are some things they are lacking. Basic things, like blanket. Let me say, blanket.
For those that have a ward
Yes. So, if given an opportunity to come to Baringo, because the work of women rep actually is legislative, and they are like part and members of the parliament. So we are going to sit down with our political leaders and discuss on those agendas and put priority to ensure that those hospitals are operational. For me, I have been handling women in my career for over 20 years. I have worked with women and children, even in the department where I am. Actually, I am a neonatal trained nurse also. And neonatal trained nurse is about neonates, new babies, newborns. So you'll find in Baringo we'll have newborn units, and maybe we don't have enough staff who are going to operate on those machines. And if you don't know how to operate on those machines, what will happen? I don't want to mention what will happen. So in case of emergency today, maybe a woman wants to deliver, and maybe there are some complications which has arise. And where will you take that woman actually? Because if you come to Kabarnet, they'll tell you take to Eldoret. And maybe through your own pocket and through other means. Before that woman reaches Jeblodge, are you sure we will still have a live baby there, or even the mother?
It may be difficult.
It may be difficult, and those are the areas I would like to handle so much as a medic. Because you'll find that even in the society today, you'll find children who are born, and maybe we call them a physical challenge because of maybe delay in management. Sometimes when you find a baby whom we normally call as a medic, baby who has had birth asphyxia. Birth asphyxia actually is hypoxia in the brain. So if this child is born with a delay, the child lacks oxygen, the brain, and that brain can get damaged. So later on in life, this child will be a challenge to the family in so many areas. So I normally ask a simple question like this. Who are you going to blame for a child who is brain damage? We're going to blame.
Yet there are things that should have been controlled.
Yeah. So I normally say like this. You blame number one, maybe the mother, because maybe she did not go to hospital early. Second, you'd blame the nurse who was maybe observing. Maybe the mother reached hospital, but there was no proper observation. Third, you'll blame the doctor, maybe he was not around for emergency section. And now we end up getting that kind of a baby. It is very devastating. So we need to handle medical issues as a priority, and we ensure that our hospitals are operational. There is no need of constructing so many dispensaries because there is money. Just because you want somebody to have a tender of a cement or a tender of sun.
Or even
construction. We ensure that if it is constructing a hospital or a dispensary, we complete, and then we go to another one, and then we make sure that it's operational. So for my colleagues who are nurses also, maybe I will still lobby to ensure that their studies also is taken care of, they go to do further training. Like for me, I can say where I am. My employer have really done their level best to empower me in so many areas. Sometimes I get trainings, get sponsored, and then when I come back, I give the best care. So we can still even lobby some of the funds to ensure we give them an opportunity to go and study, and then when they come back, they can be able to manage those machines very well.
So, well, your thoughts are that you would be working closely with the county government to ensure that you sort out the health-related issues and ensuring that health facilities are operational in Baringo.
Yes.
That's a major concern, really. If you were to do a poll right now and ask people if the nearest facility is working or not, you might see a lot of, you might be shocked by the kind of feedback that you would get. Now, moving away from the bit of health, is there any other thing that you wish to give it a priority among the people of Baringo as we head to winding up this conversation?
Okay, we have also the issue of this, what do we call, the cattle rustling, which has become like part and parcel of the major problem that Baringo people are facing. So what are we going to do to stop this? Because it has actually affected so much. And sometimes I ask myself questions. Why is it that it is only in Baringo that such things are happening? I cannot hear those things happening in the parts of maybe Central. It's only in Rift Valley. Let me say Rift Valley, but specifically Baringo. Does it mean that people are not watching, people are not seeing? Those are questions we need to ask ourselves. If our government today are able to send even soldiers to go to Somalia and to ensure there is peace, something can be done in those valleys. And we need also to encourage intermarriages. Right now, we can see even some of the Pokot are married, have married the Tukans and even the people from the Elgeyo Marakwet. We need to encourage that so much so that whenever they want to do that, they will know that even their children are there. We need to have a negotiation team. We need to have wazee who can sit down and find out the root cause why these things has been happening for a long time. And sometimes I say also like this, we need also to have spiritual leaders who are spiritually mature and they can be able even to fast and pray for that issue to stop. Things can be difficult as far as humanity is concerned, but it cannot be difficult in the eyes of God. So even those areas, maybe in the future, what we are anticipating is we need to have even churches constructed there. And we need to lobby even the NGOs to have a place there so they can be able to teach people morals. Yeah, because it's like a tradition which was not handled. So, and then those areas also I can say, we need to ensure that we have even dams and irrigations. People become busy in their lands and also education-wise. We still ask our leaders, especially the security team, to do something about it. It is not too late. It can be stopped. And our people will live in peace. It is very devastating to be in your own area and you cannot sleep. And children are dying, women are dying. In fact, the people are more affected because if a man is killed, then you leave a widow and the children. Very sad.
Quite sad.
Yeah.
Well, this morning,